All right, today we're tackling a big one, tuberculosis. This is a disease that's been with us for thousands of years, and believe it or not, it's still one of the deadliest infections on the planet. So, what makes it tick? Why is it so darn persistent? Let's dive in and find out. Think about this. You've been coughing for weeks. You're feeling weak, just completely drained every single day. And you chalk it up to a bad flu, right? Something you just have to push through. But what if it's not the flu? What if, while you're trying to just get through the day, something much more serious is actually growing inside you? Yeah, a dangerous infection could be taking hold. And that's what we're talking about today. Tuberculosis, or TB for short.
So let's get into it. This is an ancient and really deceptive sickness.
The bad guy here is a very specific type of bacteria called mycobacterium tuberculosis. And, while most people think of it as a lung disease, and it usually is, it can actually spread and attack lots of other parts of your body too. Okay, so how does this thing even spread? Well, the way the bacteria gets around is kind of scary. It spreads through the air. That's it. When someone who has an active TB infection coughs or sneezes or even just talks, they release these tiny little droplets with the bacteria inside. And here's a really important point. You can't get it from touching something or sharing food. It's not spread by touch. It's all about breathing in that contaminated air. This is where it gets a little tricky, because TB really has two different forms. Think of it like this. Latent TB is when the bacteria is in your body, but it's sleeping. Your immune system has it cornered, walled off, so you don't feel sick and you can't spread it to anyone. You're not contagious. But then there's active TB. This is when the bacteria wakes up and starts multiplying like crazy. That's when you get sick, and that's when you can infect other people. So what's the trigger? What wakes the bacteria up? Well, it's almost always a weakened immune system. Things like other illnesses, HIV or diabetes, for example, or malnutrition, smoking, heavy drinking, even just being under a lot of stress for a long time. All these things can weaken your body's defenses and give the TB bacteria the green light to go from latent to active. Living in crowded or poorly ventilated places also seriously ups the risk. Okay, this is super important. How can you tell if that sleeping bacteria has become active? Well, your body sends out some pretty clear warning signs. And knowing what to look for, that's your best defense. There's one sign that's more important than any other. The number one thing to watch for is a cough that just won't quit. I'm not talking about a regular cold and flu cough that's gone in a week. No, this is a cough that hangs on for more than 2, maybe 3 weeks. It's persistent. It's the biggest red flag your body can wave. And it's not just the cough. You should also be on the lookout for other symptoms. Things like a fever that just kind of lingers, or waking up drenched in sweat at night. Maybe you're losing weight but you're not on a diet, or you just feel bone tired all the time. These are all signs that your body is working overtime to fight something serious. And here's the thing. TB doesn't always stick to the lungs. It can get into your bloodstream and travel to other parts of your body. And when it does, the symptoms completely change. If it hits your brain, you might get terrible headaches. If it settles in your spine, you could have severe back pain. It can even affect your kidneys or lymph nodes. It just goes to show how dangerous this can be if it's not caught early. Okay, I know that all sounds pretty scary, but now I want to talk about the good news, the most hopeful part of this whole story, the cure. Because here's the absolute best part. TB is completely curable. With the right treatment, we can beat this thing. It's not easy. It takes time and commitment, but it's possible. So what does that look like? The standard plan is a 6-month treatment. For the first 2 months, you're on a powerful combination of antibiotics to really knock the bacteria back on its heels. That's the intensive phase. Then, for the next 4 months, you continue with fewer medicines to make sure every last germ is gone. It's a long haul, but it works. And listen, this is maybe the single most important message about treatment. You have to finish all the medicine. A lot of people start feeling better after a few weeks and think, hey, I'm cured, and they stop taking their pills. This is a huge mistake. It's so dangerous. Because when you do that, you're leaving the toughest, strongest bacteria behind. And those survivors can multiply and come back as drug-resistant TB, which is a whole other nightmare to treat. And recovery isn't just about the medication. You've got to support your body through the fight. That means eating well, lots of protein, fruits, and vegetables to build your strength back up. And it definitely means avoiding alcohol and smoking, because those things will just weaken your immune system when it needs to be at its strongest.
All right, so treating the sick is one piece of the puzzle. But what about stopping the spread in the first place? Well, when it comes to prevention, awareness is our best defense.
So how do we do it? First, we need to catch it early with diagnosis and testing. Second, we have to make sure people complete their entire treatment course. That's how you break the chain of infection. And third, simple things like making sure homes and public places have good airflow and using a mask if you need to can make a massive difference. And one last thing on this, and it's so important. TB is a medical condition. It's not something to be ashamed of. There shouldn't be any stigma around it. With the right care and a good support system, people can and do make a full recovery and live totally normal, healthy lives. So I'll leave you with this question. Which is more dangerous, the tuberculosis bacteria itself or our ignorance of it? Because really, when you think about it, the bacteria is tough, sure, but it's our lack of awareness that gives it its real power. The moment we understand the signs and how it's treated, we can fight back. The real danger was never the illness. It's in choosing to ignore it.